Homeopathic Health Solution presents the second prescription webinar on 25th July. Now, what do we mean by second prescription? The second prescription can be defined as a prescription which is made each time the patient comes for the follow-up. It can be more specifically defined as a prescription which is made after the previous prescription has acted completely. This definition theoretically sounds very simple, but practically this is the most tedious task for the physician, because a hurried, wrong second prescription can spoil the whole case, no matter how well it was taken and how well the simillimum was selected for the case. Patience in prescribing the second prescription, confidence in the previous prescription, and proper knowledge of organon are the key factors in the second prescription success. Hurriedness in making the second prescription without properly addressing the condition of the patient is negligent act on the part of the physician. Second prescription can be 1. Wait and watch or prescribe a placebo after the first prescription. Number 2. Repetition of the first remedy. And number 3. Change of medicine. Now let's go to number 1. Wait and watch or prescribing placebo after the first prescription. The foremost rule of making the second prescription is to give enough time for the previously prescribed medicine so that it can act completely. If the patient comes for the follow-up and says that there is no change in his symptoms or in general condition, restudy the case. If the first prescription was selected properly on the totality of symptoms, have confidence in it. Do not change or repeat unless it is very urgent. Just wait and watch or prescribe placebo for the patient's satisfaction. Chronic diseases are of long duration and may be complicated by suppressive treatments. So it may not be possible for the medicine prescribed to produce changes within 6 to 7 days. Unless the symptoms of the patient demand change, it is always advisable to just wait and give the medicine more time to act. Most well-made prescriptions get spoiled because of the hurried second prescription, whether that is a repetition or change of remedy. Number 2. Repetition of the first remedy. Now, after the first correct prescription, changes will appear in the patient's symptoms. Some will increase, some will decrease, or new ones will appear. In such a case, while the symptomatology is in change mode, the physician has to wait and not repeat. In due time, the physician will observe that the symptoms have returned to their original state, as when the patient first sought help, with the same generals and particulars, but in less severe form, or even in more severe form. The time to repeat the first remedy is when the improvement has stopped. If the patient benefited after the first prescription and now, after an interval is passed, the original symptoms return, the physician can believe that the first prescription was correct and he may repeat it. However, do not repeat a remedy that is still active. Repetition at that time will disturb the action of the remedy. Also, when the original symptoms reappear, don't change the remedy. When the patient says that he has no symptoms or they are very decreased in intensity but still not feeling completely well and not improving further, the case has come to a standstill. In such a case, wait till you get some guiding symptoms to prescribe on. If after waiting no guiding symptoms appear and no further improvement is taking place, the repetition of remedy will help in further improvement of the patient. A new remedy cannot be given because of lack of any new guiding symptoms. The same remedy can be repeated many times where the case becomes standstill. The same potency can be repeated until it will not act any longer. A complete range of potencies can be tried when you are sure that the previous medicine has acted and has benefited the patient. If a remedy has benefited the patient, never leave it until one or more doses of higher potencies have been given. Point number 3, change of remedy. Now, the change of remedy can be either an antidote or selecting a new remedy for the case, which can be completely new remedy or complementary remedy or cognates or different antisoric remedies or an intercurrent remedy. What is an antidote? The remedy must be antidoted when there appear a lot of new symptoms after the first prescription. But before antidoting, the case must be restudied and it is to be confirmed whether the patient has experienced these new symptoms earlier in his life. If old symptoms are appearing, better to wait than to antidote, as gradually these new symptoms will disappear. In case the new symptoms are very disturbing and don't belong to the pathogenesis of the remedy, or old symptoms, it is better to antidote and take the case again, prescribing on any new and original symptoms. If the symptoms belong to the pathogenesis of the medicine, wait and watch, as long as the symptoms are not very disturbing. These symptoms may pass away, and after that you can retake the case and select the more correct symptom. Selecting a new remedy. When striking new groups of symptoms appear, this new group of symptoms demands a change of remedy. When symptoms of patients are changed and he is not improving generally, this is also the time to change the remedy. When, after the first prescription, you have waited enough and there is no change in any symptoms, he is the same as he came to you for the first time, it is advisable to retake his case and select a more correct symptom. Lastly, when a higher potency of the remedy which benefited the patient has been tried, but now it is not showing any benefit, this implies that the medicine has done all the good it can, and this is the time to change the remedy. Complementary medicine. The first prescribed medicine is an acute one and it relieves the patient for a time, but repeatedly the same symptoms with the same intensity appear. In such a case, the acute remedy has to be complemented with a deep acting remedy. For example, calcarea carb is a chronic of belladonna. Cilicia is a chronic of pulsatilla. Cognates. The cognate medicines are closely related to each other. These medicines are so closely related that a medicine always leads to one of its cognates. You know the famous cycles. Sulfur, calcarea carb, lycopodium follow each other. Causticum, colocin, staphylos aureus follow each other. Lastly, change of plan of treatment. It is applicable during the anti-miasmatic treatments of chronic disease. The patient's symptoms indicate psoric miasm and so an anti-psoric is given. After the prescription, the patient's psoric symptoms are better and now the symptoms are showing syphilitic or psychotic predominance. This is the time to change the plan of treatment and a new anti-miasmatic, anti-syphilitic or anti-psychotic remedy is to be selected on the basis of new symptoms of the patient. Intercurrent remedy. Sometimes even after a careful selection, after a tedious case taking, the remedy is unable to produce any favorable effect on